Let's go ahead and get started. Let me introduce who I am. My name's Eric Auger. I'm the Director of Research and Development here at American Business Systems. So we'll talk a little bit more about that as we go through the presentation this afternoon. If you have any very specific questions about what we're doing here at American Business Systems, be sure to ask your questions during the webinar today. There is a question and answer box over there that you can actually type in your questions. We certainly like to have those questions come in throughout the afternoon. Let me discuss who American Business Systems is, who we really are. We've been in business going on 20 years. This coming 2014. And for the last 20 years, we have been working and helping folks just like yourself in what we call the ideal home-based business. It is I love what Patrick calls it. It's a clean type business. It's one without inventory. You don't have to have a brick and mortar building. You can actually work this business directly from your home and your home office. We are a cloud-based billing system. When we say cloud-based and when we say billing system, we're talking everything. We're talking about the medical billing portions of it, the EHR side of it, the clearinghouse, the eligibility. We have it all. It's all under one roof. So you're not having to worry about if one program system is going to work with another program. So we'll certainly be able to show you that, and even at a different time if you'd like to see a demo of the system. We'd be happy to show that to you. If you haven't already been to our website, it is absystems.com. There you'll find a lot of information about the business. You see about all these different services that you see here in the middle with these boxes here, everything from iClaim to EMRX to Audit Guard to CodeWrite. And folks, this is all inclusive. Everything that you get, that you see here, is what you get as a ABS licensee. You'll also see these orange buttons here. So if you want additional information, this is where you're going to want to go. You want to get into what's called our virtual brochure. And as I kind of step through these, you'll see these little arrows pop here for you to see that there are sections about a little bit more detail about the opportunity, how we actually help you get clients, videos about training, about support, very specific about the technology, like I was just showing you just a moment ago about the cloud-based billing. And then when you're ready to get on board with us, those final steps, as you can see right there, it has all the paperwork, the agreements, and everything that you need to do, and then you'll finally get welcomed to the team. We are part of one of the largest independent groups of medical billing companies called Healthcare Billing and Management Association. We've been a part of that for the last 3 to 4 years. Also here in the Fort Worth area with the Better Business Bureau, we have an A+ rating. So if you want to go check us out there, you certainly can. We also would like to invite you out to our corporate office here in Keller, Texas, just north of Fort Worth. And we would love to have you come and join us and visit with us at any given time. Our next training class is April the 8th through the 12th. As you can see there, we have about 7 seats available. And Patrick and I will talk a little bit more about that again throughout the presentation today. You give us a call here at 866-565-8413. Let me introduce to you our founder and CEO of the company, Patrick Phillips. Patrick is an author, also a speaker that I'd like to introduce to you. He has written these 3 books here and some others, but more importantly, How to Reprogram Yourself for Success. Here's a book here in the middle, Wake Up, Live the Life You Love. And then finally, this book that he co-authored with a CPA friend of his called Cash Crunch to Cash Flow. And this book is actually to help you as a licensee build your business. So let's get Patrick on the phone here. Patrick, it's good to have you here this afternoon. Let's get this thing kicked off.
Thanks, Eric. Appreciate that. All right. Well, hey, today's topic is a pretty interesting one, especially since we have a very special guest on the call here with us today, which I'll introduce here shortly. But first, I just ran across this quote. You've heard of Richard Branson, haven't you, Eric? You know who he is? He started Virgin Airlines. And
at first, I thought you were going to have a special guest, and he was going to be on here.
Well, I wish I could get him on here. He's a bazillionaire. And he said recently in one of the magazines, Success Magazine, he says, across the country and around the world, legions of people are abandoning their dependence on big business and seeking independence through their own enterprises. Every month, about 1 million Americans go through some type of job change or loss, and increasingly, they are deciding to start their own business. Isn't that good news? We've seen that for the last 20 years, haven't we?
we have, and I tell you, and not just over the last 20 years. I mean, we've really seen it escalate here in the last 5 years, Patrick.
Yes, especially since Obamacare came on board. Doctors are kind of panicking. They don't know what to do. They would rather focus on their patients and outsource the billing to somebody else. And our licensees are just they're ready to take that over and step in and help those doctors out. So, folks, if you have been looking at starting your own business, at least consider this one. Medical billing, doing medical billing for doctors is a very profitable business. Once you get it up and running, you could be making an executive income and still work in your pajamas. Yeah, that's the good news. Okay, so let's get right to the subject today, which is why will doctors choose you to do their billing? Now, Eric, if I had the space and the time and all that, I would have come up with a better title for this, because really what I want to aim this towards today is, people ask that question all the time. Why would the doctors choose me to do their billing?
Right.
Why couldn't they just do it themselves? Which, of course, a lot of them do.
Patrick, we do get that question a lot. Why would, especially for folks that are just getting into the business, why would they even choose you? So I think it's a great topic. It's a great title because it truly is.
Because there are other medical billers out there, right? I mean,
Absolutely.
people know that there's other people doing medical billing, other medical billing companies that have already been established. Why would somebody who just started out in this business, why would a doctor choose them? That's what it's really all about today. So it should say, why will doctors choose you to do their billing rather than somebody else?
There you go. Absolutely.
Well, one of the reasons is because, as you mentioned earlier, Eric, we at American Business Systems actually have a complete solution. I mean, this is pretty unique. I don't know of any other company in the United States that has anything like what we've put together here. Because when you take all the pieces of the puzzle that you see here, the billing system, the electronic medical record system, and, of course, the built-in clearinghouse that's integrated totally within all of this, and then, of course, the people that are behind. That's what's going to make you stand out in this marketplace, folks, is to have something like this. There is no other billing company in your area, I can assure you, that has all these four things. Very important. First of all, our private labeled iClaim, which is the billing system itself, and then the electronic medical record system, which a lot of doctors don't have and need, or they don't like the one they do have. And then, of course, like Eric said, we are the only company that has a built-in integrated clearinghouse within our system. So this is why you can get your claims, processed and accepted a whole lot easier because it is all integrated. You're not depending on a third party. And then, of course, the last piece of the puzzle there are the people. That's you, and that's us. As the nation's largest network of independent medical billing companies, you will be a part of something that's very unique in the United States. So that's a good way to start out, isn't it, Eric? That's about, we could end right there. That's why really doctors will choose you over somebody else.
Let's make this, because people, again, they're having to take our word for it at this time. But folks, what we can do is at times if you're along in your process, we can show you a demo and explain to you what we mean by this is why doctors will want to use you and choose you, because we do those demos for you, for your doctors. And when we do those demos, Patrick, you've been on those, and you've heard the doctors just go, wow,
yeah,
you are right.
About the whole thing, wow.
So we do have
blown away.
We do have a unique. A lot of people like to ask, what makes me different? What's the differentiator? What is the value proposition? Folks, what Patrick is showing you on the screen, this is exactly what we're talking about.
Yeah, snap a picture of that right there, folks. That's all you need to be able to realize that you're going to be very unique in the marketplace that's out there today. So let's jump right into the first reason why doctors would want to outsource their billing to you, and that is you let the doctor focus on his or her core competency. Yeah, their core competency is what?
Doing doctor things.
That's right. Listening to people's heartbeat.
There you go.
It's seeing patients, and of course that's what doctors were trained to do, and so that's why they're focused on that, and they want to focus on that, but they can't in some cases because even the doctor, him or herself, are drawn into that whole billing thing that's going on inside the office because they're having to bill the insurance companies and Medicare to get paid. Let's face it, most people are using some sort of insurance or they're on the Medicare. And, of course, with the new Affordable Care Act, known as Obamacare, as that moves into place here in the next year or so. Wow, how many are they saying, Eric? A new
Wow.
32 million or something like
Right.
that, uninsured Americans.
Absolutely. Yeah, just a ton of people about to come into the system.
Yeah. So rather than the doctor not focusing on the patients, they're having to focus on the billing. You, working from your home, could be that person who takes that burden off of the doctor and lets him or her focus on the patients. That's what they want to do. That's what they really. There's two things doctors want to do, and I think our guest today will verify this. They want to see patients, and they want to get paid.
Get paid.
That's
Absolutely.
all they want to do. And in between, they have to do the billing or have it done by somebody else, of course, or they wouldn't get paid. So,
Hey, Patrick, I want to interject this real quickly because it was just a couple of weeks ago. I was doing a demo for one of our licensees with one of their doctors, and I actually asked that doctor, I said, when was the last time that your EMR system let you know that the patient that you're about to see, that their insurance is good? And I had that doctor say, I have never had that. And the reason I share that with you is because now the doctors, because of the way our system works, Patrick, is that it gives the doctor an indicator when that doctor goes to see that next patient. There's a little green dot there that tells that doctor, this person's ready to go, and you know what? That doctor knows he's going to get paid on that patient. That's a good thing for the doctors.
Right, because, again, just to kind of further explain that to the listeners, it's because our system in real time checks for whether or not that patient is eligible with that insurance
right.
So that the doctor can get paid. If they're not eligible, he's not going to get paid.
So, again, I brought that up because of the fact that, again, people ask, why will a doctor use you? Those are the issues because, folks, we're not trying to sell them a piece of software. What we're trying to do is show them that you as an ABS licensee has what it takes to get that doctor paid. That's what we focus on, their revenue.
That's right. So their core competency is seeing patients. And that brings up point number two. One of the reasons doctors will outsource to you is because you can help those doctors see more patients. Listen, here's a quote right here. The Galen Institute says the healthcare legislation, that's Obamacare, will provide more people with access to care. But the challenge is getting enough primary care doctors to meet the patient demand. Now, that's scary when you think of 32 million uninsured Americans being dumped into the system. That means the waiting rooms are going to be packed. That means that people are going to be having to schedule way out. You think it's hard to get a doctor's appointment now. Wait until 32 million more Americans are into the system, and you'll see that doctors are going to be overwhelmed. I think, Eric, that this is going to be a boom for us and for our licensees, don't you?
Absolutely, and especially with not only the increase of patients. What about any signs about doctor shortages?
Oh yeah, that's another quote I've got here from the Association of American Medical Colleges. They say there will be a shortage of 150,000 doctors in the next 15 years. Now, if that's the case, I mean, I don't know. I guess it's because maybe not as many people are graduating from medical college or not interested in going into medicine because it doesn't pay as well, or maybe because the government they think is taking over healthcare. For whatever reason, there's going to be a lot of less doctors, more patients, less doctors. So, folks, do you see why you are a necessary part of the solution to this problem? You take that burden of the billing out of their office and let them focus on now the staff in the doctor's office can actually help the doctor see that many more patients. Maybe he sees 25 patients in a day, and he can now see 35 or 40.
Right.
So anyway, that's why that should help. Well, Eric, I think I'm going to try to see if we can unmute our guest. She's been graciously waiting on the phone here, and let's see if we can get her unmuted here. And if so, then she'll be able to talk to us. Sally Combest, are you on the phone today?
Greetings, I am here.
You had to unmute, I could hear.
Do you hear me?
I sure can. Well, thank you for being on here today.
Great.
Sally is a doctor down in the San Antonio area here in Texas, and she just happened to be on the webinar today, and we've been talking with her, of course, because in the past, Sally, we're not going to reveal too much about your private situation down there, but she wants to get into this area that is in the medical billing field. So she became a licensee and is now working towards. I guess you plan to completely get out of the clinical side of medicine and into the business side. Is that right?
Yeah, that's correct. I'd like to transition over and help other docs do better at what they're doing.
And so this topic is pretty pertinent here if you think about it, because, folks, you're actually able today, if you want to, is actually type in the questions that Sally could address specifically. As a doctor, she knows that there are reasons why the doctors will want to outsource to her as well as to you if you decide to get into the business. And so, Sally, tell us, for example, this whole subject that we've just been talking about here, why doctors will be seeing more and more patients. That should be a huge problem for doctors, wouldn't you think?
Well, you'd like to think that more patients would be more revenue for the doctor, but the shortage is coming from multiple different levels, and one is honestly, yeah, applications to medical school are down. College students are kind of rethinking, well, maybe medicine is getting too complicated and too burdened by the government, but there's no doubt. I think the numbers are actually more in the mid 40 million people who are not covered currently that can be coming into the system. Yeah, and also the other issue is that now with baby boomers at retirement age, you're having 10,000 people every day in America turn 65 and enter the Medicare system. So there's no shortage of patients to being seen, but the reality is so I think the shortage is relative also. It's just relative to the number of patients that need to be taken care of.
So the conundrum really is that doctors have to probably see more patients, but it doesn't necessarily mean it's going to increase their revenue that much, because if the government is involved in it and limiting what can be paid for certain things, then maybe the revenue doesn't really increase that much.
Well, that's very true. That's a lot of it. It may be working harder for the same amount of income that they can manage to take home after they pay all their overhead. But that doesn't mean that they won't be seen. And so it's a matter of how can they work smarter and not harder. And probably one aspect of working smarter is to let someone who deals with revenue stuff deal with it every day, and let their people in the office focus on taking care of, patient flow issues and, getting them through so they can be seen and have access to medical care. And
I'm sorry, go ahead.
I'm sorry?
Oh, that's okay. I was just going to ask, do you think that doctors do the billing themselves, some of them, in their own office using their own software and their own staff because they think it's cheaper to do it that way?
Yeah, they think it's cheaper because they figure that it's hard to watch maybe that revenue go out the door towards a third party, outsourced medical billing company. And there are going to be some who will, always, as a matter of control issue, feel like they have to keep it in-house. But there are many, many times, and I have a new client recently where we go back through in more detail and find things that haven't been posted, things that have not been sent out for claims. And, I can tell by just working with the office manager, she's completely overwhelmed. And this huge sense of relief that I hear in her voice when we have a conference call with her about, don't worry about this, we're going to take over it for you, we're going to deal with this, and let you just run the office. And once a lot of these docs figure that out, then they're really ready to find someone that can help them, that they feel like they can trust to do this. Because if my company doesn't get their revenue in, their whole practice shrivels. So, and part of why I do this is because I got really frustrated by what I saw in my own practice and in some of the situations I've been involved with, and it's just, it actually kind of makes me angry a little bit, and it's like, I can't change the laws, but I really want to build a company that's really focused on getting everything that they're due, that they're, they work hard, they pay 50 or 60% of the money that comes into their office, they pay it towards overhead. And, quite frankly, for many docs, being a physician is not quite as lucrative as it was maybe 20, 30 years ago, if in the dollars of the day.
Yep.
And so they need to be able to get what's due to them and have someone out there fighting the fight against the insurance companies who have a lot of resources at their disposal to try to keep from paying the money out that's contracted.
Yeah. Now you mentioned you recently signed up a client, a doctor that is a pediatrician. Is that who you're talking about?
No, he's a general surgeon.
Oh, general surgeon. Okay. And
Yeah.
so basically, as you know, of course, Sally, that we teach our licensees to charge a percentage of the money that they are actually bringing in for the doctor, the revenue that's collected. So what do you mind sharing with us? What did you charge this particular doctor percentage-wise?
6%.
6%. That's pretty good, isn't it?
6%.
If this doctor is doing then $100,000 a month, you would be making, what is that, $6,000?
$6,000. Yeah.
So for a doctor, they have to look at it like this. Well, yes, I'm paying a lot of money for somebody to do the billing, but what would that have cost me to do it in-house? And we're going to look at some slides here shortly that'll kind of break that down.
Well, let me give you just one quick example. I've only been working with this man for 2 weeks, and as we've gone back through, of course, we're charging a higher percentage for anything data service before our contract start date. And so there's even more because it's a little bit more to go back and kind of clean up things. But for example, in the first week, we found a lot of stuff that had been set up incorrectly in their computer. The insurance wasn't entered correctly, and things that simply had never been set out. And we're calculating it's almost $20,000 that we found that they just didn't send out for a claim. So,
wow.
Exactly. So we've already found stuff that his poor office manager just overlooked, and it was never sent to the insurance company.
Yeah,
so that's the kind
we run into that a lot. Office managers are just overwhelmed, and sometimes that just stacks up, and they just don't get to it. But that's a shame because that's money that they've already earned. They just haven't collected.
Yeah, and that's $20,000 expected per contract. That's not what's billed. And so, yeah, that's $20,000 that physician was not going to see, because if it sits in there too long, there's a deadline for it being submitted to the insurance company. And if you submit it past that deadline, the insurance company says, nope, we're not paying it. You sent it to us too late.
Yeah.
So, yeah, maybe he's going to pay, my company $6,000 this month. But look what we've already found for him.
Yeah, that's the way they have to look at it is, okay, it may sound like it's costing me something, but what's the cost of not collecting what is really due me?
Exactly. So, and it's going to leave his practice manager, to be able to focus on running that practice better.
Okay, so I'm going to move on to some other points here, Sally, and I want you to just stay on the line. If you want to, you jump in anytime you want to make a comment about anything here, because you know more about, all this than I do probably anyway. So
that's debatable.
All right, well, here's the third reason that we came up with why doctors would want to outsource to you, and that is you can help those doctors collect more money faster from the insurance companies and patients. Hey, that was a great tie-in, a lead-in to that, wasn't it? From what you just said, we definitely can get them more money from those insurance companies and even the patients themselves. A lot of people don't realize that doctors worry about their cash flow, what they refer to as their revenue cycle. Right, Sally? The revenue cycle, and they don't know how to manage that sometimes, do they? So
agreed.
We've decided that There is a huge need out there. We're not the only ones, of course. Here's a book you can pick up at any bookstore called Prepare to be a Millionaire. This is 43 millionaires in 7 different industries, and one of them is, he calls himself, oops, sorry, I went backwards there for some reason. Pushed the wrong button. Here it is. He calls himself a medical reimbursement specialist. And all that means is he's in medical billing. And what he says is that over the next 10 years, the medical industry is going to be the most wide open field. Every doctor, dentist, hospital, and clinic has trouble collecting money from the patients and the insurance companies. That's what we just said. And I believe over the next decade, so much money will be made in this particular industry that it will blow you away. So, folks, do your due diligence. And the more you look at this industry, the more you'll realize that there is money to be made in this. And that's why, of course, Dr. Combes got involved in this as well. This quote from the McKinsey Corporation says physicians typically collect only about 50% of the outstanding patient balances, resulting in almost $60 billion in bad debt annually. Now, Sally, I don't know if you've run across this or not yet, but as you walk into doctors' offices, you'll find a little drawer sometimes that they have where they've put all the different bills that the patients owe, and sometimes it's, $250,000 that has not been collected from the patients. That's rightfully theirs.
I have seen 6-figure balances on patient. Yeah.
Yeah.
I have seen that. It wasn't $250,000.
Right. We have a service called Choice Pay, folks, that you'll learn more about there on our website if you haven't already. And it basically helps collect that money from the patients, gives the patients options to pay their bill. And in fact, it even helps with what they call the days outstanding. On most invoicing programs, you'll see that for most businesses, it can be, 20, 30 days. Well, this is 52 days for doctors, and more than 20% of their balances are 120 days out. That's, 4 months. So we can bring that down to as little as 14 days collection from the patients, and from 50% collection up to 98%. So that's one of the reasons why doctors would need you, is you can help collect more money for them from the patients.
Hey, Patrick, and then just the other day, I actually saw an article with HBMA, that organization that we said that we belong to, talking about they're really going after doctors to help them get those patient payments in there, and using something very similar to what we have. And Patrick, we've had this Choice Pay for how many years now? 10 years?
Yeah, 6 or 7 at least. Yeah. So we're way ahead of the curve there, aren't we?
we really are. It was kind of interesting to read the article that I read the other day. I thought our ABS licensees are already doing that, so it was pretty nice to be kind of supported by the HBMA.
Yeah. All right, number 4 is you can save doctors a lot of money. As we were just talking there with Dr. Combes, she has found out that, of course, it does pay for doctors to outsource, even though she's charging them, a nice percentage there, sometimes 5, 6, 7, even up to 8%, depending on the doctor and the specialty and so forth. And here's why. Look at this picture of a doctor's office. Here's a typical doctor's office. I knew you'd like that, Eric. I couldn't find a doctor's office, so I just found this old photo of a bunch of people working. But in a typical doctor's office, it looks kind of like this. You got a lot of people back there behind that bulletproof glass, right? And they're all doing something. Well, here's what they're doing. They're doing the billing for the doctor. They're not really doing as much for the patients as they should be. They're focused on all of that billing, the insurance companies, contacting them, dealing with Medicare, and mailing out the patient statements. So we can solve that, folks, because that costs a lot of money, having people just do all that for the doctor. In fact, this quote from the New England Journal of Medicine, of all things, market analysts estimate that 24 cents out of every dollar is wasted on administrative expenses. Folks, let that number sink in. They're saying that 24% of the doctor's revenue is spent on the administration and billing side of his business. Now, that is a lot more, as far as I can tell, than 6%. So even though Dr. Combes is charging 6%, the average doctor is spending, well, let's cut that in half. Let's say half of that is just other administrative things, and the half of it is the billing. That means 12%. So it's twice they're spending at least twice what Dr. Combest is charging this particular doctor. Now, here's a good example from a typical doctor's office. We came up with this little chart here just to kind of explain that. Eric, you want to kind of go through that with them?
Sure, absolutely. Here we've got, in a nice little format here, an annual cost for physical billing. It's pretty clear, as you can see on the right-hand side, not much to it. That's just taken in consideration about 6% of about 400 claims there over a 12-month period, about $100 at that, is going to give and yield about $28,800. That's for outsourced billing, and that's what you would get as a medical billing company. On the other hand, on the in-house cost, it takes about 1.5 people, and because there's usually someone doing it and someone part-time doing this, and that just that salary alone is right about $46,000, almost $47,000, as you can see there. Then you got the payroll taxes, then you got workman's comp insurance, then you have errors and omissions that the doctor has to have themselves, any training costs, leave of coverage, if they've got to get some temporary work in there, employee benefits package about $5,100, hardware, software, IT to keep up with that. And actually, I bet you that's even low on that side, because if they have to have their own medical billing platform, I know it's more than that. So we've calculated that to be about $65,000 comparative to $28,800. So folks, this is another reason why a doctor would use you, because you could see just the savings alone that they would get. Not to even say, once you start doing the billing, like Sally has said, you're going to find those big nuggets of lost money. So not only are you going to save them money, but you're also going to increase their revenue. So this is just the beginning. This is just the tip of the iceberg of everything that you would be able to do and present to the doctors.
Yeah, and Sally, I don't know if this means anything to you, because I have no clue as to what you've earned as a doctor, but I'm sure even $36,000 for the typical doctor is, if they could save that each month, that's a nice down payment on a nice car, isn't it? She may have left us. I don't know. She said she's got other things going on. So
I think you may have her muted here. Let's unmute her here. Sally, you still there?
No, I'm here.
Okay,
I am here. Okay.
Yeah, we were just talking about
I'll tell
savings.
you. Yeah, I could hear you. I'll tell you, the way that doctors know that, we already know that reimbursements are being cut. And, we had a cut January 1st. And that's usually with the Medicare, and then a lot of the insurance companies tend to follow suit. So their reimbursement starts trending down to closely get similar to Medicare. So they know, and we all know, that we've got to save wherever we can, and they're overall very motivated to cut expenses however they can. It's just sometimes hard to get them to understand the expenses of doing this in their office, because it's so embedded with all the other activities going in there that often it's hard to kind of get them to see what it is for them to do it there. And that's why that chart that you just showed was very good.
Yeah, it's an educational process, isn't it? Doctors think that everything's under control and that they're certainly probably paying a whole lot less to do it themselves. But when you actually see a chart like that, it brings it home, doesn't it?
Yeah, it does. And the other thing that I want to impress upon the listeners is, unfortunately, physicians get very little to no teaching themselves, either during medical school or their residency training, on the business side of medicine. The nuts and bolts of how this works is simply not discussed. It's almost like I'll be honest, it's like the money aspect is beneath us. We have to spend all of our time on learning how to take care of the patient, which of course is the more important. But with the healthcare economic environment now, these new doctors coming out of training, they really need to be armed with more information. And since they're not, then we can become the experts to go in and help them out.
Yeah, and you've actually done some stuff like that at some of the expos and conventions, and you even had, I think, a lunch and learn or a seminar where you can actually educate the doctors and bring them up to speed, because, like you said, they don't get that training in medical school.
They do not. Yeah, that's right. But, I don't mind if they're hesitant to learn it, because then that means maybe they're more likely to turn that aspect of their business over to me. And it is
it's a good thing. Yeah. So we educate them enough to make them realize that they need to get that out of the office. Yeah.
Yes, exactly.
Here's one study that was done that found that when you calculate all of the additional hidden costs, of the phone inquiries, the duplications, the resubmissions, all those extra things in the office, it can cost as much as $57.46 per claim to get a claim paid. Now, in a typical general practitioner's office, Eric, I don't think they even net that much on a visit sometimes.
No, they don't. It's amazing how even
No.
if we were to look at this and actually show this to a doctor and show them that's what they're doing, there's where a lot of money is being lost right there.
Yeah, because if you ask the typical general doctor, what do you think it cost you to process an insurance claim in your office? They certainly wouldn't use that figure, would they, Sally? I mean, I think they would say probably,
No,
I don't
never.
know, it might cost me $2 or $3, $5. They might use some ridiculously small figure.
They would never imagine it would be this, and it would be scary for them to even look at this, because sometimes a Medicaid reimbursement for a straightforward visit by a Medicaid patient might pay $20.
Yeah. And so you can't afford really even to file that kind of claim if you're doing it yourself. Now, if you're just paying a percentage to somebody to do the billing for you, then it doesn't matter, because it's still just 6% of whatever it is.
That's right.
Here's another reason. Now, this might seem a little contradictory, because we just talked about doctors seeing more patients, but you can actually help doctors who need to grow their patient base. A new doctor, for example, right fresh out of college, or just opening their practice, of course, don't have the number of patients. And many doctors, if they don't pay attention to it, just from death, and attrition, people moving off, they will lose a patient base if they're not doing something to grow that. You can actually help with that, because there's nothing more expensive than what you see here on your screen. That is an empty waiting room, because all that overhead in the doctor's building there is very, very expensive, not counting his salaries and so forth. So we have a service that you can offer to doctors that actually solves that problem. It's called AutoCard. It's an online database of these are cards, but they're actually cards that are printed in full color, just like a greeting card, and mailed out to the patients. So we have a whole campaign of cards that you can design specifically for that doctor, putting that doctor's signature in the card. You do all this online, push a button, and the cards are mailed by the system automatically. So it's a tremendous way to help doctors that you wouldn't be able to help otherwise. All right, I'm just moving through these points pretty quickly here. But, Eric, if you see any questions that are coming in you want to address, just let me know.
Well, I do want to, before we get way to the end, I do want to ask this question to Sally, probably on behalf of all the listeners and those that will listen to the recorded version of this. Okay, so Sally, you're a doctor. You pretty much know about all this. You've gone through the ABS training yourself. How do you feel that what you've learned through that, because you went through people that are not doctors and have not been in the medical billing field at all, how do you feel like, these folks that are looking to get in this business know that they'll have the confidence to go out there and do this?
Oh, I feel they will, very much so. I mean, I did. I sat that full weekend training. I met people from all over the country, coming from a lot of different walks in life. And, that week of training really imparts so much of what is needed to get out there and build a business. And then the support is always there. It doesn't end with the last day of training. So if there's questions, the support with ABS is still there in order to provide some guidelines and ideas and reminders of how things work. So it's always back there to lend a hand.
Could
I
you,
really
you
kind of think of ABS almost like a consulting company for starting a medical billing business.
well, that's a great way to put it. And I was going to say, you yourself, you've used support yourself, even though you've been in the medical field. You've had to call upon support yourself, and
Yeah.
kind of talk real quickly about that as Patrick's getting ready to show the next screen here.
Oh, absolutely. I called up because a couple of these things I haven't, a couple of the services that are involved in the package I um, hadn't had any opportunity to use, and just in the past couple of weeks have looked into the iDocs, and sometimes pricing on things may change, or I may say, remind me how does this work? Who do I talk to again? How do I make all this flow and work? And that's been very recent. Still calling back and saying, what should I do with this or that?
Well, and I wanted to ask that question because, it's almost like I can hear that question coming through the webinar today. So I wanted to kind of ask that. I know we kind of got just a tad off the topic there, but that's one of those questions, Patrick, that we do get asked about. Do I have to have medical background to get into this business?
No.
Well, that's a good
No.
point, Eric, because having a doctor here on the webinar shouldn't indicate to people that you certainly have to be a doctor to get into this business. Sally, in that class that you were in, that was sometimes last year.
Yeah.
How many people do you think were in there that had a medical background? Do you remember?
Let me think. Essentially none. I can't remember, and I still keep in touch with some of those people. Um, I can't remember anyone who had.
It's very, very rare that we actually have anybody
It
with
really
any kind of
is.
medical background. Yeah.
Yeah, I mean, there were people who were coming from other aspects of business. I remember there was an accountant. Um, there was one guy who had a cousin who was a chiropractor. That was about the closest. Um,
Yeah.
a retired executive from a major sports team.
Yes.
So I can't remember anyone with any kind of formal medical training
Eric, I
whatsoever.
would say in general, Eric, wouldn't you think it's usually 2 or 3 people, maybe one or two in a class that has any kind of connection to the medical field at all?
You're probably right. If I were to guess and get a good guesstimate, I would say probably less than 10% of our licensees in general have had a background. Now, with that said, it's interesting to know that we are appealing to somebody like a Sally Conbest, who is a doctor, and as well as I do, we've got a licensee that has just come on board. She's coming to class here in April, who has been in the medical business. She already has some clients. Matter of fact, she's a certified professional coder, and but yet she's coming to American Business Systems because she sees the value of the iClaim, the EMRX, and the marketing portion of it to help her grow her business. So, Patrick, we really get everybody, people that have been in business, in the medical billing business, people who have never been in the medical billing business. So we really do get probably, but then again, the majority of people that come in the business is pretty much people who are coming in and brand new. They don't know anything about it. That's how we're able to help them out and be successful there.
Yeah, because if it depended on your background in this, we wouldn't have a lot of people coming through this training at all, and we certainly wouldn't have all the success stories that we've interviewed here on the webinars. All right, let's see. Wow, we've only got about 15 minutes later here. Hey, by the way, Dr. Combest, I did not mean to hold you on this whole webinar. If you need to run, you just run. It'll be fine.
Oh, I appreciate it, but no, I'm good right now.
Good. You're working there at home, out of your home office?
I am, exactly.
See, that's what's great about this, folks, is you don't have to have a commercial office space at all. Okay, so number 6 is the reason doctors would outsource to you is you can get doctors paid quicker by getting their claims filed in a timely manner. Now, this was shocking when I saw this quote here, but it says 29% of claims were received from the healthcare provider more than 30 days after the service was provided, and 15% of the claims were received more than 60 days. So, Eric, can you imagine a business, a normal business, a typical business, billing their customers 30 days after they actually provided a service or sold a product. That's unheard of, and yet that's what happens.
I can't imagine that. And then as we know in the medical field, that a lot of these that do get filed, a lot of those, a big percentage of those get rejected, and a lot of those claims never get refiled. So you probably have even a higher number of these claims that are never even paid. That's where Sally was kind of talking about, found money for that doctor.
Yeah, and of course, as an ABS licensee, since ours is a cloud-based system, web-based, you can log into it 24/7, which means any time you have time to do the filing, you do it. And since all of this data from the doctor can be sent to you electronically, there's no picking up or paperwork or FedExing or faxing even. It's all sent electronically directly to your computer from the doctor. So you take that data and put it right into our system. Why couldn't you do that the same day? Certainly not 30 or 60 days later. All right, number 7. Doctors will want you to do their billing because you can reduce the claims rejection rate and thus increase the doctor's revenue. Now, that's because a single physician practice can expect an average of 69 rejected claims per month. A rejected claim is, what are all the reasons, Eric, that a claim can be rejected? Give us some ideas as to why.
I'll give you one very simple one, and one that we show right there at the first part of any demo to a doctor, and that is a claim could be rejected just simply because of incorrect patient information in their billing system. And we have quality assurance checks in our system that allows and actually eliminates those types of rejections. So that's one of them. That certainly is just one of them right there.
Yeah, just incorrect data, and then of course coding can be involved in that, and all kinds of reasons. But look at this: the average number of rejected claims for medical practices averages about 34%. Eric, I'm not real smart in math, but that's about a third, isn't it?
That's about as close to a third as you can get.
1/3 of all the claims filed are rejected. And folks, like Eric just said, a lot of those are never, refiled. Here's a case. Huh?
I was going to say, I think the last report I saw is that 50% of all rejected claims never get refiled.
Yeah, that's amazing. And here's a little study that we did. One of our licensees actually gave us this and said, here's the comparison between what the doctor using their current system versus my system using me. In other words, on the right-hand side of that chart, did. And look at this, Eric. This doctor had not 34%, but 60% rejection rate.
Yeah, that's pretty incredible. And Patrick, the only reason that this doctor was staying alive, basically, because I believe she was a surgeon. So there was a certain amount of money that was literally coming in, but
almost $1 million a year. Yeah.
Yeah.
And of course, with our system, because it's real-time, cloud-based, integrated with the clearinghouse, and all kinds of error checking that it does, we can get that rejection rate nationwide. Eric, it's actually less than 2%, isn't it? A little bit less.
Absolutely.
So for this one doctor, we saved them about $500,000 in, I should say, increase their income by $500,000. Yeah, that's a 41% increase. All right, so here's another reason why doctors would want you to do their billing. You can get the rejected claims resubmitted quickly. And here's a quote that I found, Eric, that just says, and it's a range, 25 to 40% of the rejected claims are never resubmitted for payment. Think about that. It's an average of about 30% or something like that. 33%.
Well, it gets back to what Sally was saying earlier, is that if this is being done in a doctor's office and it's the office manager that's in charge of this, that office manager is not only just doing billing, she or he is doing so many other things. And so, the next day's set of claims have to get filed the first time, let alone all of these claims that get rejected because of issues with their third-party clearinghouse.
Don't you love that picture?
I do.
That is a frustrated doctor right there. Okay, so number 9, why doctors would outsource their billing to you is because you can increase the doctor's revenue by making sure he or she is not undercoding. Eric, explain what this little thing is coming up right here.
That is what's called a superfill, folks. That is what the doctor uses, or probably currently maybe using to do their visit with an encounter of a patient. There's all of their codes there that they customarily use, and they're just circling. You know, if this person has a sore throat, well, there's a code for that. If this person has an earache, well, there's a code for that. And so the doctor's just circling these things, and then the doctor takes those and then gives those to you. What Patrick is saying here about undercoding here are these procedure codes, and these procedure codes is really where the money lies. So if a doctor is seeing a patient and the documentation could support a higher code, but the doctor is in fear of being audited, they're actually doing what's called undercoding, which they're getting less money. And that's one of the things that we're able to help find.
That's right. And since our system actually makes suggestions on some of the codes, then we're able to increase the doctor's revenue. Here's a good example right here showing on this zoomed in picture of a super bill. Doctors see visits on different levels, they call it, depending on how much time and what they do for the patient when they're in the office. So they may be billing this as a level 4, which gives them a certain amount of money from the insurance company, but it might be that they could be billing it as a level 5, which would increase their revenue sometimes up to 30–40%. So, you know, you add that up over hundreds of patients seen in a month's time, and it can really mean a big difference in a doctor's, cash flow. In fact, here's a quote from Mike Inger of the VIA Code. He says the average physician could increase their monthly billing by about 30% if their medical coding was done accurately. So you have a service as an ABS licensee that can help with that problem as well. It's called Code Right, and it can actually improve the reimbursement rate for doctors up to 30%. It's a series of looking at their codes as they currently code and suggesting from certified medical coders who do this report for you as an ABS licensee. You just are the intermediate person there showing this to the doctor. But we do the report, we produce that report, give that to you, you go back to the doctor with that, and they are always very impressed with what comes out of that reporting. So there's just one of the reasons why you have a foot up on all the other medical billers that are in your office. In your area. Not many people have these types of services, folks. It comes from 20 years of experience in this industry.
Well, Patrick,
yeah.
I was just going to say here. I mean, I don't know if you got Sally still on the phone here, but you know, I mean, does Sally, do you have all those codes memorized yourself?
Oh no. I coded some of my own work just today. And I have to pick up the book, look up the code for certain things.
So again, I guess a lot of people kind of get a little frozen whenever it comes to these codes. So the reason I asked that was to show you that even the doctors themselves, they don't know all the codes. So that's why there are certified professional coders out there, and that's why you have that service with us here at ABS.
Well, it's also why all of those codes are actually built into our system. If you put a code in, for example, that doesn't exist, that claim can't go through until you correct that. It may be that the doctor gave you the wrong number, or you just, a typo, you put it in wrong, but our system will catch that kind of thing, folks. And so you can't submit it with the wrong code because our system is going to make sure that it's correct. Again, we have certified medical coders behind the scenes that keep our system up to date. So every time you log into our system, remember, you're using the latest codes that are in there. All right. Why else would a doctor use you to do their billing? Well, you can save them thousands of dollars on software upgrades. Now, folks, you may not realize it, but there is software out there, of course, that still comes on a CD. It's called client-server-based software. And it installs right on the hard disk of your computer right there in your own office or in the doctor's office. And it's very, very dangerous, and it's very expensive because the upgrades to that, keeping it updated, can be thousands of dollars a year for a doctor. Now, since our system is cloud-based computing, it means that every time you log in, you're just simply going to a browser like Internet Explorer, for example, and you're logging into our site where you do the billing, and every time you log in, you are using the latest version. We may have upgraded it overnight, but when you log in, any little bugs that were there or new features we wanted to add, it's already there. There's no downloading and upgrading and reinstalling the software and so forth. You can even access our system on any internet-enabled tablet device. So it's all meaningful use certified, meaning the government has approved it for use with doctors to get some of the stimulus money that's due to them. It's a wonderful system, and you never have to worry about those hidden costs that are back there. Even on a smartphone, a doctor can access the scheduler, for example, to see what appointments they have. They could be out golfing and say, oh, I think I have appointments coming up, and they just look at their phone, and there it shows it right there. And the little dots you see there on that screen, see the yellow dots, and the green one there by Charles Harrison Charles, that is somebody that's been approved through the eligibility. So the doctor knows that that person has already been checked, that they are ready to be seen. And that's another reason why we can increase the doctor's revenue, because he's only seeing the patients that he knows is eligible for the coverage. I know I'm going kind of fast here, but we're getting kind of close to the hour here, so I just wanted to squeeze in everything we can. This one is pretty important. You can protect the doctor from being audited and find thousands of dollars. Now, Sally, if you're still on the phone there, you might even address that. We mentioned earlier the codes that are out there. Sometimes Medicare comes along and audits a doctor for those codes, don't they?
Yeah, that's true. And that's becoming actually, physicians are becoming more aware of the reality of those audits and quite fearful, to be honest. It's a big deal because if, there's often when you're coding what level of involvement your visit took with a patient, it isn't always, it's kind of a gray zone. Is it a level 4 or did I do enough with this patient to actually go ahead and call it a level 5 and get more reimbursement? And, the audits can come in and say, no, you should have made it a lower level and you overcharged us and therefore we demand you repay that. And that's becoming a really scary thing for people who can make honest mistakes.
Yeah, it's thousands of dollars sometimes for the codes that they
Yes.
find that are incorrect, aren't they?
Yeah, you can, not only can you be required to pay back what they determine is overcharging, but if they decide that you're doing it purposefully, then they can also add punitive fines that can be quite devastating to a practice.
Oh, yeah, you hear about Medicare fraud sometimes in the news. The doctors being fined thousands of dollars, some of them being sent to prison because they were doing it, legally, illegally. They were trying to defraud the government.
Yes, that's true. And you know what? I'm not going to deny that there is an occasional physician who's just being blatantly upcoding in order to get more reimbursement. But what I worry about are the many more who just make coding errors because it's not, and again, we're not taught how to code in residency. So it's something you kind of learn on the job. And again, it's always not really clear cut. It's kind of this gray, how involved a visit. So those are the ones that can really get hurt, I'm afraid.
Yeah, and of course, Sally, you talked here recently with some other doctors about the audit guard service that you can offer as an ABS licensee. This is pretty neat. It has a report. I think you've sent some of them these reports that you get, some sample reports.
Yes.
Showing what was found in certain doctors' offices. And boy, sometimes it's kind of shocking. The doctors are really thrilled to be able to see that they can be audited with this pre-audit that you can provide for them to protect them against that. Because if Medicare does come in, they can pull out these reports and say, well, I was audited, and these certified medical coders, of course, told me where I needed to correct, and I am correcting. And you've got some proof there that you're trying to do the right thing about the code there.
Exactly. If you can show the government, And remember, this is when the government decides to audit you, audit medical practice, they come in with the full power. I call them the IRS of, medical healthcare in the country. They can come in without your permission. They walk in and they say, I want so many charts, and we're going to look at them and see how you're doing. But if you, and I've told this to other physicians, if you have this self-audit from an independent third-party resource that gives you feedback on how well you're coding your own visits, it goes to show the government that you are making an effort to do it correctly. It doesn't mean that you won't have to repay anything that they think is an overcharge, but it certainly can help you get out of being fined punitive fines on top of the reimbursement. So it's just a way to say, hey, Mr. Government, I'm doing my best here on trying to do this, and I even had my own charts outsourced to be checked for me.
Right. I actually paid to have certified medical coders review what I'm doing, and that
exactly,
that is a great CYA for the doctor.
Exactly.
If Medicare does come in.
Exactly.
Hey, Patrick, I know we're up at the top of the hour, and before we might lose anybody because they may be time crunched here, wanted to just kind of get to the last few things here about the upcoming workshop. You want to talk to them about how many seats we have left here?
Well, according to Rhodey at our office, 7 seats are open, and folks, it only holds, as you can see from the picture there, about 20 people in the classroom, so there are 7 seats open, but that's only 1 week from Monday, right, Eric? Yeah.
That's correct. And so, kind of Monday, this weekend being a holiday weekend, it's kind of making it tight. So, folks, if you really are looking to get into this, be sure to contact us. Now, we'll be open. We're here Friday and Monday, so we're not closing. So if you need help, we're here to help you out.
Hey, before we wrap up here, I know we're getting into the money-back guarantee and so forth, Eric. I want to say thank you to Sally Combest. Sally, thank you so much for being on here with us today and joining us and just speaking up there and kind of validating what we're saying.
Well, I appreciate it, Patrick. I enjoy helping to spread what little bit I know about the process and what I've learned and really the great opportunity that's here with ABS.
Well, thank you, Sally. I appreciate that very much. And we're here. Just holler if you need us for anything. We're always available.
I do.
Okay. All right.
All right.
Hey, take care on that trip to China here in a couple of weeks.
Oh, thank you. I'm very excited.
I'll bet. All right. Take care. Bye-bye.
I'll let you know. Okay. Bye-bye.
Okay. Yeah, folks, we want people to know that we know that this is a big decision. We know that there's a lot of things going out there on the internet that you're not sure about, and so we encourage you to do your due diligence. But as part of that due diligence, think of actually coming to our workshop as part of that, because you can come down and at the end of the training workshop on Friday, when it's all over there about 1 o'clock on Friday, if for any reason you don't think this business is right for you at that point, just go to any of our staff members and say, I don't think this is right for me. It doesn't matter why. We're not going to grill you. You don't have to fill out anything. You just basically arrange for you to receive a full refund of your license fee. So we don't know how to be any more fair than that. We don't know of any other company in America that does anything like that. I don't. Do you, Eric? That's pretty unique.
No, and it is unique to at least our business, because I know that any other medical billing companies, the only way you get training is to sign up, and when you sign up, there is no return. So there you go.
That's right. Well,